Hello, my name is Dr. Dewan S. Raja. Today I will discuss about coarctation of aorta. Coarctation of aorta is a congenital anomaly. It is a birth defect in which the aortic lumen is constricted just distal to the origin of the left subclavian artery. There are two types of coarctation of the aorta. One is infantile form, often symptomatic in early childhood with tubular hypoplasia of the aortic arch proximal to the patent ductus arteriosus, and an adult form with a discrete ridge-like infolding of the aorta just opposite the closed ductus arteriosus, that is the ligamentum arteriosum, distal to the arch basins. Arch basins are the brachiocephalic trunk, left common carotid artery, left subclavian artery. Okay, so this is the infantile form. Here there is narrowing quarters from the aorta. This is the ductus arteriosus. This is patent. It is directing blood from the pulmonary trunk, okay, to the arch of the aorta. And this is the adult form. Here, the ductus arteriosus became the ligamentum arteriosum, and there is narrowing here, narrowing. Okay, so without patent ductus arteriosus, this is with patent ductus arteriosus. The infantile form, this is the adult form. It may be here, it may be here, there may be quarters on the aorta. So if we look at that, here the ligamentum arteriosum has not been shown. Here, this is narrowing of the aorta. This is the coarctation of the aorta. Okay, so we got this is the ascending aorta, arch of aorta, three major branches like brachiocephalic trunk, left common carotid artery, left subclavian artery. Then this is the coarctation of the aorta. There is the narrowing of the aorta. Coarctation of the aorta is twice as more common in males as in females. So men may have more chance to get coarctation of the aorta, the male child, than that of the female child. Female with Turner syndrome, that is a chromosomal anomaly 45X0, phenotypically female with lacking secondary sexual characteristic chromosome number 45X0, they have more chance to get coarctation of the aorta. Encroachment on the aortic lumen is variable. How much it is constricted, how much it is narrowed, it is variable. Sometimes leaving only a small channel and other times producing only minimal narrowing. So this is compatible with life. It is very minimum narrowing. Although coarctation of the aorta may occur as a solitary defect, in 50% of cases, it is accompanied by a bicuspid aortic valve. We know that aorta has the semilunar valve. We have three cusps. Sometimes we may have two cusps. So in those cases, that heart may be associated with coarctation of the aorta. Its blood vessel narrowed. The distal part of the arch of aorta may be narrowed. Okay. Or it may be associated with other congenital defect like aortic stenosis, atrial septal defect, ventricular septal defect, mitral regurgitation, or Bainey aneurysm of the circle of Willis. Bainey aneurysm are small aneurysms, dilatation of the blood vessel seen in the circle of Willis may be at the bifurcation of the basilar artery into posterior cerebral artery, may be anywhere in the circle of Willis, just beyond circle of Willis, like at the anterior communicating artery, at the posterior communicating artery. So coarctation of the aorta may be associated with Bainey aneurysm. what happened? What is the pathogenesis? With age, intercostal arteries enlarge due to collateral circulation. There will be establishment of the preductal and postductal blood vessel. Preductal blood vessel like the internal thoracic artery and the anterior intercostal artery. The anterior intercostal artery are the branches of the internal thoracic artery. Anterior intercostal artery will anastomose with that of the posterior intercostal artery. Those are the branches of the descending thoracic aorta. These are the postductal branches. So with that of the anterior intercostal artery, preductal branches, they will anastomose and it will be very prominent. It may erode the ribs. So here is the coarctation of the aorta. Aorta is narrowed here. Okay. And this is the ligamentum arteriosum. This is the ascending aorta, arch of aorta. This is the descending thoracic aorta. These are the posterior intercostal arteries. Okay. So these are prominent. They will anastomose with the branches of the internal thoracic artery. These are postductal artery. These are the preductal artery. Duct means the ductus arteriosus or ligamentum arteriosum. And eventually this anastomosis is so prominent it may erode the inferior border of the rib like this. It is a plain X-ray chest. This is an MRI, so you can assess the extent of erosion as well as the aortic aneurysm and dilated posterior intercostal arteries here. And this has been taken from Google Image American Heart Association journal Circulation. Okay. So, with significant coarctation, murmurs are present throughout the systole. So, it is pan-systolic murmur. Murmur is the abnormal heart sound due to abnormal passage. Our passage is abnormal. We have coarctation of aorta. Sometimes a vibratory thrill is also present. Symptoms. Symptoms of coarctation of aorta. Clinical manifestation depends on severity of the narrowing and the patency of ductus arteriosus in infants. Symptoms might include difficulty breathing, poor feeding, failure to thrive, cyanosis localized to the lower half of the body because lack of blood supply there. Okay. And also there is a lot of deoxygenation of the hemoglobin there. In older children and adults, symptoms can include high blood pressure, hypertension, okay, headache. Headache may even lead to rupture of berry aneurysm, maybe subarachnoid hemorrhage. There may be epistaxis because of high blood pressure in the upper part of the body, muscle weakness, leg cramp due to intermittent claudication, ischemic condition in the calf muscle, and cold feet because lack of blood flow to the lower limb. Some individuals may be asymptomatic and the condition might be discovered during routine physical examination. They have minimal narrowing. They have coarctation, but it is not very big constriction. Complication of coarctation of aorta. What are the complications? High blood pressure in the arms and certainly high pulse volume. Low blood pressure in the lower limb, and also there may be very feeble pulse in the popliteal artery, posterior tibial artery, dorsalis pedis artery. Even the femoral artery pulse may be feeble. Heart failure. There may be also kidney failure because of low blood flow to the kidney may stimulate the renin-angiotensin system. They even aggravate the blood pressure condition, may lead to hypertension again. Heart failure, because heart is pumping against an obstruction, heart is failing. There may be left ventricular hypertrophy. There may be changes in the coronary arteries. Aortic aneurysm, ballooning of the aorta. Not only that, it may rupture. That may be catastrophic. And it may go through the dissection between the layers of the aorta. Stroke or cerebrovascular accident, endocarditis, may happen, infection to the heart's lining, like the endothelium. The reduced blood flow to the lower body can lead to symptom of peripheral artery disease. This is PAD, peripheral artery disease, such as leg pain or cramping of the calf muscle during exercise. We call it claudication, cold or numb feet, and slow wound healing in the legs. Wound healing is slow because lack of blood flow, lack of oxygen. Diagnosis, how can you diagnose coarctation of the aorta? Okay. Physical examination, a noticeable difference in blood pressure between the arms and legs with lower blood pressure in the legs. Imaging studies, chest x-ray, will see the rev erosion. Echocardiogram, ultrasound of the heart, MRI, CT angiography can confirm the diagnosis and assess the severity. Electrocardiogram to evaluate heart's electrical activity and detect any abnormalities. Treatment of coarctation of aorta. Surgical treatment is essential here. Removal of the narrowed segment of the aorta and reattachment, anastomosis, or use graft. Balloon angioplasty and with stenting, a minimally invasive procedure where a balloon is used to widen the narrowed section, sometimes followed by stent placement to keep aorta open. Okay. It is a mechanical problem, so mechanical obstruction should be removed surgically. Medical management, medication to control blood pressure like beta blocker, angiotensin converting enzyme inhibitor, angiotensin receptor blocker. So we may use medication, but idea is that as because it is a mechanical obstruction, you must remove the mechanical obstruction by surgery. Although this does not address the narrowing itself, this medication. Okay, so treatment is just surgical. That is the best treatment. Prognosis, coarctation of the aorta with patent ductus arteriosus usually manifest early in life. Indeed, it may cause severe signs and symptoms immediately after birth. Okay, may not be severe, but certainly it is shown the signs symptoms. Okay, depending on the narrowing of the aorta. The delivery of unsaturated blood through patent ductus arteriosus produces cyanosis localized to the lower half of the body. Many such infants do not survive their neonatal period without surgical or catheterized intervention to occlude the patent ductus arteriosus. Early diagnosis and treatment usually result in good prognosis. Untreated coarctation of the aorta can lead to severe complication, including premature death due to heart disease or stroke. Regular follow-up is essential to monitor the recurrence of the narrowing of other cardiovascular issues that might develop over time. Okay. And that's all about the coarctation of the aorta. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.